Welcome student. I am Mr. Abhijit Bambre, working as assistant professor at Gokhale Education Society's Arts, Commerce and Science College Jawhar. Today we are going to learn anti-inflammatory drugs. What is anti-inflammatory drugs? Let's move. Inflammation and its causes. What is inflammation? Inflammation can be defined as the series of changes that occur in the tissue following an injury. It is not only one change, it is a series of changes occur in tissue following an injury. Actually, when a wound or cut swell up, turn red, it hurt, it may be a sign of inflammation. Got it? Then it may be recognized by some symptoms, that is calor, rubor, tumor and dolor. Calor, it is a Latin word, it means heat. Rubor means redness, tumor means swelling and dolor means pain. Inflammation, it is a series of changes that occur in the tissues following an injury. It may be recognized by some symptoms or four cardinal signs of inflammation, that is calor means heat, rubor means redness, tumor means swelling and dolor means pain. Next, inflammation. Injury brought about by a various condition may cause inflammation. Few of them are as follow. Inflammation caused by some physical agent, inflammation caused by some chemical agent, inflammation also caused by some biological and pathological condition or biological agent. Physical agent like mechanical shock, ultraviolet or ionizing radiation. Inflammation may be caused by some radiation, that is ultraviolet or ionizing radiation. It may be caused by mechanical shocks. Then chemical agent like phenol, toxic amine and caustic inorganic compound like nitric, sulfuric, perchloric, hydrofluoric acid, caustic soda and caustic potash. Next, biological agent. Toxin, bacteria, hypersensitivity caused by sensitized bacteria, intracellular replication of virus. It also cause of inflammation. Simply, inflammation means a swelling. Pathological condition like rheumatoid arthritis, which is an autoimmune disease. Due to this, inflammation are caused. Arthritis or rheumatoid arthritis, it is a chronic inflammatory disorder affecting many joints, including those in the hand or in the feet. Actually, rheumatoid arthritis is a chronic inflammatory disorder affecting many joints, including those in hand and feet. Inflammation is caused by some physical agent, some chemical agent, biological agent and some pathological condition. Next, inflammation is a normal, essential protective response to any tissues damaging event that may threaten the host and may vary from a localized reaction to a complex response involving whole the organism. Inflammation is a essential and protective response. Actually, Then an inflammation may be either it may be primary or secondary response to tissues damage. Inflammation may be primary or it may be secondary. Primary response is a direct defensive action against external agent. Primary response is a direct defensive action against external agent, while secondary response is an indirect or slow defensive action. Example of primary and secondary defense are inflammation caused immediately after bone fracture is an primary response. During the accidental cases, inflammation caused immediately after the bone fracture is a primary response. Means swelling after the bone fracture, immediately swelling after the bone fracture during the accidental case is an primary response, is an primary inflammation, while inflammation due to rheumatoid arthritis is an secondary response. Rheumatoid arthritis, it's a chronic inflammatory disorder related to joints. Got it? Inflammation are protective and essential response. It may be primary or secondary. Primary response is a direct defense action, while secondary response is a indirect or slow defense action. Example of primary inflammation is inflammation cause or swelling caused immediately after bone fracture, while secondary inflammation example, inflammation is due to rheumatoid arthritis. Next, mechanism of inflammation. What is mechanism of inflammation? When a tissue is damaged due to injury, any injury, it may be accidental, it may be pathological, it may be biological, it may be chemical. When a tissue is damaged due to injury, it may be any substance called as mediator are released at the site of injury or at the site of particular site of injuries. These compound, when injury take place, suddenly substance called as mediator are released. These compounds are capable of mediating or inhibiting the inflammatory responses and the associated pain. When injury take place, mediator are released. Mediator, it may be any histamine, it may be serotonin, plasma kinase, lysosomal enzyme, prostaglandin, etc. Mediator, it may be histamine, serotonin, plasma kinase, lysosomal enzyme, prostaglandin, etc. Actual sequential mechanism of inflammation may be described as follow. First, injury cause inflammation, then the inflammatory mediator are released which try to inhibit inflammatory response, means some mediator are secrete or released after the injury, means histamine is released. Third one, then blood flow at the affected area is increased due to vasodilation. Vasodilation means widening. Then vascular permeability is increased due to vasodilation, which result in cellular infiltration at infected site, which cause inflammation, that is edema. Edema means a swelling. Edema means swelling. Cellular infiltration increase the quantity of platelets and macrophages, that is type of WBCs, which is useful to repair the damaged tissues. It's all about mechanism of inflammation. Inflammation, when injury cause inflammation, then mediator are released. It may be histamine, it may be serotonin. They release, then blood flow at the affected site is increases due to vasodilation. Due to vasodilation, vascular permeability is also increases, which result in cellular infiltration at the infected site or at the injury site, which cause inflammation, that is edema. Edema means a swelling. Next, type of anti-inflammatory drugs. What is anti-inflammatory drugs? There are two types: steroidal anti-inflammatory drugs and non-steroidal anti-inflammatory drugs. Steroidal anti-inflammatory drugs. The adrenocortical hormones and glucocorticoid hormones are used as steroidal anti-inflammatory drugs. Example of adrenocortical hormones and glucocorticoid hormones are cortisone and hydrocortisone acetate. Nowadays, prednisolone and betamethasone are modified steroidal drugs which are used as a steroidal anti-inflammatory drugs. They are more active as compared to cortisone and hydrocortisone acetate. Prednisolone is an intermediate acting drug. Prednisolone is an intermediate acting drug, while betamethasone is a long acting drug. They are used as topical application of inflammation caused by arthritis and rheumatic disease. Arthritis and rheumatic disease is related to joints. Inflammation caused in joints, in feet or in hand. There are some side effects of prednisolone and betamethasone steroidal anti-inflammatory drugs. Side effect: anorexia, then gastritis, hypertension, and glaucoma. Anorexia is an eating disorder. Anorexia is a side effect of prednisolone drugs or excessive dose of prednisolone. It causes anorexia. Anorexia term, it means a eating disorder. Then hypertension and glaucoma. Glaucoma means a group of eye condition that can cause blindness. It is a group of glaucoma. Glaucoma means it is a side effect of prednisolone and betamethasone drugs. Glaucoma is a group of eye condition that can cause blindness. Here a structure of prednisolone and betamethasone. Those are steroidal anti-inflammatory drugs which are used for inflammation treatment. Next, non-steroidal anti-inflammatory drugs. Due to several adverse side effects, due to many side effects or several adverse side effects like anorexia means eating disorder, then glaucoma, hypertension, etc., steroidal drugs are replaced by non-steroidal anti-inflammatory drugs whenever possible. Due to many side effects, steroidal drugs are replaced by non-steroidal anti-inflammatory drugs. These drugs are mainly effective in the treatment of rheumatic fever, rheumatic arthritis, non-steroidal anti-inflammatory drugs. These drugs are mainly effective in the treatment of rheumatic fever, rheumatic arthritis, spondylitis, and osteoarthritis. It's all related to joints inflammation. What is rheumatoid inflammation? What is rheumatoid inflammation? Is a characterized by a swelling, immobility of joints. Rheumatoid inflammation is characterized by swelling, immobility of joints and fever, whereas arthritis is inflammation of joint. Rheumatoid inflammation is characterized by a swelling and immobility, means stiffness, mobility of joints, and arthritis is inflammation of joints. Basically, the anti-inflammatory drugs modify the inflammatory response given by the body to disease but do not remove the cause of disease. It modify the inflammatory responses. Next, the non-steroidal anti-inflammatory drugs are classified according to their chemical structure. First one, aryl acetic acid derivative. Second, N-aryl anthranilic acid derivative. Third, salicylic acid derivative. Fourth, aryl propionic acid derivatives. Fifth one, naphthalene acetic acid derivatives. Sixth, organo gold compound. Seventh, pyrazolone and pyrazolidiones. Those are non-steroidal anti-inflammatory drugs. Example of N-aryl anthranilic acid is diclofenac and aceclofenac. Actually, aceclofenac is a derivative of diclofenac. Both are used to treat inflammation caused by osteoarthritis or rheumatoid arthritis and ankylosing spondylitis. They have side effects such as ulceration and hepatotoxicity. Hepatotoxicity means acute or chronic liver disease. Excessive dose of diclofenac or aceclofenac cause hepatotoxicity. Hepato means related to liver disease. It's all about anti-inflammatory drugs. What is inflammation? There are 4 symptoms of inflammation, that is we say the 4 cardinal sign of inflammation, that is calor means heat, rubor means redness, tumor means swelling, dolor means pain. Actually, inflammation is when a wound or cut swell up, turn red, hurt, it may be a sign of inflammation. It is a series of changes that occur in the living tissue following an injury. Then there is various condition they cause inflammation, that is some physical agent cause inflammation, some chemical agent cause inflammation, some biological agent, as well as some pathological condition like rheumatoid arthritis, they cause inflammation. Then mechanism of inflammation, type of anti-inflammatory drugs. There are two types: steroidal anti-inflammatory drugs and non-steroidal anti-inflammatory drugs. It's all about anti-inflammatory drugs.